and welcome back to the Medical Care Organizations course. And today we're going to do lesson 5. Lesson 5 is going to be on chapter 5 of the Delivering Healthcare in America textbook, which is on medical technology. So this is going to be a really cool chapter. We're going to kind of get into, we're going to look and see how medical technology has empowered us and brought us to where we are today. We're going to look at some of the cool things that we're able to do with medical technology. We're going to look at and see why we're able to reduce medical error. And we're going to see where we could be going in the future. All right, so medical technology has benefited us so much. And it's great that we are in the lead in the world today. So some major benefits of modern medical technology that we have been able to, that have improved our lives and our health over the years are that it has improved diagnosis and treatments. Okay, so we can detect cancer early. We can detect a lot of things early on before they actually take, devastating effects to our bodies. We can stop them early on and we can start treating them. Okay, so that's actually pretty amazing. We can do a lot of diagnosis exams and catch things early on before they really set forth and really do some damage, okay, before it's too late in some cases, right? So we've improved our diagnoses. We've also improved our treatments, okay? So we have higher level treatments that we're able to use. We have treatments now that are way less invasive than they have been in the past, okay? And of course, everyone knows, or I hope you guys know, that when our treatments are less invasive, that prevents a whole mess of other things that can happen to us, okay? When it's less invasive, we don't necessarily have to, we reduce the risk of getting any kind of infections or, developing any other kind of diseases or having slow recovery and things like that, right? We've also improved sanitation, we've improved our nutrition and our living conditions. Okay, and as a result, our life expectancy has doubled since, remember, the pre-industrial period and even early post-industrial period. Our life expectancy was not as high as it is today. Actually, it continues to grow, because I remember when I was a kid, if you said that you were able to live until you're 70, that was like, whoa, you lived a long life, a very full life. If someone said 100, that was just like insane, right? But today, if someone lived until they're 70, 75, it's not that impressive anymore, because our life expectancy has increased. We can expect to live a lot longer, okay, with the medical technology that we have today. Okay, let's. So, modern technology in the United States. Here in the United States, one of the biggest reasons for why we have been able to become the lead in modern medical technology is because we don't have a lot of restrictions. Okay, in fact, instead of restrictions on our resources and our medical technology, we have encouragement and support, and we have a lot of, even the government gets in on this, and the government is willing to dump a lot of money into our research and development. Okay, so we have a lot of support, and we have this drive, this natural American technological imperative drive to develop more technology. Okay, so in the United States, we don't have cost containment. Okay, when it comes to medical technology, we have very, very few controls. Really, the only controls that we have, for the most part, with our medical technology are those that have to do with safety. Okay, as long as we're safe, it's like, keep going, keep inventing stuff, keep coming up with new, bigger, better treatments. And we don't really worry too much about the cost. We just keep inventing, keep innovating, okay, keep doing more research. Okay. So if you compare us to Canada, to the Canada, as opposed to all those Canada impersonators out there comparing us to the actual Canada. Anyway, compare the United States to Canada and how they're able to develop medical technology compared to how we develop medical technology. It goes back to what I said in the previous slide. The United States does not really exercise much control at all, okay, over our development and our research and development and our coming up with more medical technology, and even just having corporations that will not invest in the new medical technologies and treatments that are coming out. Okay, whereas in Canada, they use supply side rationing. So even if there is a bunch of new technology that is available, Canada's going, well, it's not in the budget, or we can work it into our budget, but where every facility is not going to have the, a certain thing, or maybe they won't make it standard until for a while, until maybe prices drop or something like that, because Canada is a national health insurance, has a national health insurance system. So it's completely ran by the government. Everyone that, the medical practitioners are going to be government employees. The facilities are owned by the government. So really, they are definitely going to practice supply side rationing because it's the government's responsibility to take care of all of the citizens. Okay, so it might not be in the budget for them to invest so much into medical technology. It might not be in their budget that year to incorporate a lot of the new medical technologies that have been invented or have come out into the market and diffuse them into their society, just because it might be too expensive. It might not be in their budget. However, in the United States, we have a privatized system. Okay, so it's not governed, or it's not under government control. Okay, so our different facilities and our physicians and everyone, we can invest in all the latest medical technology out there. Okay, we can incorporate all that stuff into our facilities. We can start using them, and it can become normalized in our society a lot faster than it can in other not privatized systems, just because of how we work, because we are more entrepreneurial and capitalistic over here. So we can have we have our hospitals investing in new medical technologies for them because they want to stay ahead of the curve. They want to compete. So competition is kind of fierce over here as well. So whenever we come up with medical technology, we got facilities over here, especially like the big ones with all the money and the cash, so they can invest in all these new, all the new stuff that comes out and use that on their patients. And of course, that makes them highly competitive. So most patients would probably rather go to those hospitals or those facilities that have all the latest medical technology. Okay, so usually it works out for these corporations anyway, because then they get like a nice return on their investment. Okay. So what is medical technology? I know I've been saying medical technology, and what you might have in your mind, like the picture you might have in your mind, is like a machine, like an MRI machine, or like all these computers and stuff, like hardware type stuff, right? It's usually what we think of when we think technology, but really in healthcare, medical technology is not just the machines. Yes, machines, yes. But it's also going to include like drugs, anesthetics, biological stuff like tissues and blood and things like that. Okay, and also like EHRs and the other, maybe the softwares that we use for communication from physician to patient, or softwares we use for communication between like workers or between colleagues, between physicians and whatnot. So telehealth and telemedicine come into play a lot with medical technology as well. So, there are 4 basic categories of medical technology. All right. So first we have I want to get my pen going. All right. We have those that have to do with medical procedures. This type of technology, this is for like transplants, tissue transplants, knee replacements. This usually has a lot to do with like biological stuff. Okay. So anyways, those that have to do with like medical procedures and whatnot, that's one category on its own. Open heart surgery, tissue transplants, blood transplants, things like that, that's all going to fit in that category. Okay, and then we have diagnostic equipment. So these are like those cool machines that are out there and help figure out if there's something wrong with your body. Okay. This will help physicians and diagnose the issues that you're having, your symptoms, and that way we can get to the heart of the matter and they can start treating you. Okay, so diagnostic equipment, some examples of that would be CT scans, MRIs, stuff like that. Okay, then we have the equipment, devices to render treatment category. Okay, so these equipment, devices to render treatment, these would be like those synthetic things that they use in medical procedures or in treatments, okay, like a heart and lung machine, okay, or a kidney dialysis machine, or even a pacemaker. All right, that's that stuff. Then we have the last category, and this last category is the one that you guys are going to be more worried about, or not really worried about. That's the wrong term to say. We don't worry about things. That sounds so negative. But you're going to be dealing a lot more with information technology than any other type of medical technology. And I say that because as health administrators, you'll be dealing with more information technology. Like, this is your type of technology. The other stuff along there, those are more for the clinicians. Those are for your physicians, your nurses, the tech people, and whatnot. Okay, so those are all the people that work directly with patients. Those are the different types of medical technology that they're going to deal with. But what you're going to deal with as a health administrator is going to be more so the information technology. That's your thing. Okay, so it doesn't necessarily mean you're going to be a computer genius. It just means this is the type of technology that you're going to be using. This is the tool you're going to be using to do your job. Okay, and so some examples of information technology are medical record systems and radiology laboratory reporting systems and the pharmacy data systems. So this is all just systems in the computer. This is mostly software stuff. Okay. So information technology, what is it? Information technology, or IT, it deals with the gathering, storage, analysis, and transformation of data so it becomes useful information for healthcare professionals, managers, payers, and patients. Okay, so here are some examples of some information technology that you're probably going to be using in the future as a health administrator. Okay, so we have medical record systems. This would be like the EHRs that we are definitely going to get into in a couple slides. All right, so I just want to put that right there, some EHRs. Then we got radiology and laboratory reporting systems, which you're probably not going to make use of. That's not really your thing, but you're probably going to have access to so that you can use that information properly. Okay, if you ever need it for your job for any other reason. Also, same thing with pharmacy data systems. Okay, so it's probably not necessarily going to be something you work directly with, but you may need to use that information for something. Systems to schedule space and personnel. This is definitely something that you will probably be using, especially if you work in HR. Okay. And then we have financial systems and material management systems. So these last three especially are probably something that you're really going to be working with in the future when you have your jobs and as a health administrator or a manager or anything like that, because you have to figure out a lot of what your work is you're going to be using these tools to kind of forecast what you may be needing in the future. Okay, you're going to forecast maybe the different resources, like all the medical supplies that your facility requires to care for the patients, so that you can, place orders for the different supplies that your facility is going to need. Same thing with like if you are the one who has to staff your office or your department or whatever, so you would have to forecast or be able to use these tools to calculate exactly how much labor you're probably going to need in the coming weeks or months, and then you use that amount of hours to kind of allocate between all the different employees that you have. Okay, so it's stuff like that that you're going to be using in the future. Okay, so IT has three different, well, in medical technology, we got three different applications that we need to be aware of in IT. Okay, so first we have the clinical information systems. So this is the type of system that your physicians and nurses are going to be using, right? This is mainly what your physicians and nurses are probably going to be using. This is for them to care for their patients. They're going to have to be doing like patient notes and prescriptions, diagnostics, things like that are going to be happening in there. This is where they put that information. This is pretty much what is going to make their EHR, the information for their EHR. Okay. Then we have the administrative information systems. This is the stuff that the administrators, such as yourself, will be using. Okay, so this is stuff that would have to, these are tools that you're going to be using for like financials, maybe to figure out exactly what your budget is, or what you can forecast in the future, and how you can plan your resources, or ordering things, or who to staff, and things like that using this tool. Okay, so this is the type of information system that you guys would be using. Okay, and then we have decision support systems, and these are actually go to support clinical information systems and administrative information systems. This is sort of like an add-on, a thing that would be programmed to really check the different decisions that you make. Okay, let's say you place an order for certain supplies, but you've already set in this decision support system that you typically do, this is your budget and you do not want to go over that particular budget. Okay, so maybe you're going to place an order this week for something that goes above the budget. Well, the decision support system is going to check you and say, hey, this is definitely going over the budget that you guys allow, and it might not even let you proceed. Or it will allow you to proceed if you can get like a manager to override it or something like that. So that's what these decision support systems do. Same thing with like if you were using it for a clinical information system to kind of like check that. So it could be something like a physician might be prescribing a medication for a patient in the system, in their clinical information system, and maybe that patient in its records, it's already taking that particular medication, or maybe that patient is taking something else that might not go well with this new medication that this physician wants to give to that patient. Well, this decision support system would know that because it's programmed to not let things like that happen, right? So then it would show the doctor, hey, this patient is already taking this, you're trying to prescribe this, it's not good, it's not recommended. And then maybe the doctor will have an opportunity to override that decision if they choose, or maybe the decision support system won't even allow it. Okay, so it kind of just depends on how it's programmed, but that's what a decision support system does. Okay. So health informatics. This is a study or a field of study for health information or IT, uses of IT that go further than just being there used as a tool. This is when you use IT in learning how to use IT in a way that improves healthcare. Okay, so health informatics is just using health information or studying health information and studying its uses so that we can find ways to improve how we give healthcare, how healthcare is being delivered to the patient. Okay. So now we are on electronic health records or EHRs. Okay, so EHRs, I bet a lot of you are actually familiar with what an EHR is. Usually you guys are. So I bet some of you have already worked with an EHR. Okay, so some of you may actually already have jobs out there and you get to kind of, you're familiar, right? So an EHR is pretty much a patient's medical health record, right? But it's all digital. So it's in that digital system. So it's stored electronically in their system, and it's that patient's health record. So why is this important? Why do we have to make everything digital? Well, there are a variety of reasons, but first of all, let's focus on why this actually benefits healthcare. Okay, so it actually saves money for healthcare organizations, and that's kind of that's in a lot of ways, this is how these organizations are able to get their return on the investment when they purchase an EHR system. Okay, they're going to get a reduction in medical errors. Okay, it's going to improve savings in healthcare costs and also improve health, of course. Okay, and a lot of that comes down to reduction of medical errors. And how does it reduce medical errors? Well, like kind of how we showed you before, typically an EHR will incorporate some sort of decision support system as well, so that also protects the patient. Okay, and it's going to protect the physician as well against malpractice lawsuits. This also, when we reduce medical errors, we're improving the health of the individual, and when we improve the health of the individual, they don't come back, okay, for that same diagnosis. Okay, we don't cause extra problems in the patient. Okay, they're able to recover, to get well, and to move on. Many times when medical errors do happen, like maybe there's some sort of miscommunication in the writing or something like that, then medical error will happen. The patients don't get recovered. It might cause other health issues in the patient. So the hospital has to pay for those supplies. Okay, they're going to be spending a lot more time with their staff working on that patient, trying to get them well. Who knows, the patient could say, hey, I think something went wrong here, and they could file a malpractice lawsuit. You know, a lot of things can go wrong. But having an electronic health records system can help reduce a lot of that. And in turn, that saves the organization so much money. Okay, so that's a huge reason, or a huge chunk of the return on this investment that the hospital or the facility actually gets when they have these type of systems. Okay, so a fully developed EHR system has 4 major components. Okay, now not every single health EHR system out there is going to be created equal. They're not going to have all the same components. They're not going to have all of them. They might just have 1 or 2 different components. Okay, many of the facilities that might be quite small, they're probably not going to have a fully developed EHR system. The company or the medical facilities that have fully developed EHR systems are going to be large hospitals, usually. Okay, hospitals, especially large hospitals, large teaching hospitals, and maybe huge medical care organizations. Okay, large MCOs would probably have a fully developed EHR system. Many of these small mom and pop, practices are probably not going to have them. Okay, and it may not actually be necessary. So many organizations, they'll just kind of pick and choose what actually is needed specifically for them. Okay. Interoperability is the concept of having an EHR system where all of the healthcare practitioners who are in the system, who are taking care of the patients, they all have access to that patient's record. Okay. Interoperability is allowing all of the health practitioners to have access to that particular patient's record so that they can care for that patient properly. Interoperability is a real thing in, of course, other countries because they're all sort of operated under one system and the government exercises overall control, so they're able to do things like that. They'll have like one major headquarters, so they can all abide by the same rules, same policies, and they're all connected. Okay, there's coordination amongst all the different healthcare facilities in a national healthcare system as well as a socialized healthcare system. In the United States, we don't have this. We do have interoperability, but it's not like how these other countries are. How we exercise interoperability is usually within networks. Okay, and these networks are usually under the same organization. So let's say a medical care organization will have like one major network, and so all the physicians within that network will be interoperable. Like all the physicians, all the pharmacists, nurses, all the healthcare practitioners within that network will have access to the EHRs of the patients. So that means you can, go see your primary care physician. They could send you over to a specialist, and that specialist is going to have instant access to your health records so they can care for you in a much more efficient way. And then they can send your prescription straight to the pharmacist, and that pharmacist is going to have your health records so they can also help you. Okay, because they all have access to your record. They can put more information in there so that other practitioners will be able to help you. Okay, and it's all going to be very efficient. Now, this doesn't necessarily happen, unfortunately, when facilities are not necessarily part of the same network. Okay, so if you have maybe a private health insurance provider, private health insurance provider, and they're not it's not like it's part of like a MCO or anything that's really connected. It's just insurance. Then you're sort of on your own to find your primary care physician. You're on your own to look for all these different care providers that accept your insurance plan, right? And they usually give you a list, of course, but usually you might find more often than not that when you are sent to, like, let's say a physician after you've seen your primary care physician, that they're not gonna have your records. Okay, so your primary care physician is gonna have to send it all over there, and things can get lost. Okay, there isn't really good coordination amongst providers who are not part of the same network. Okay, so the connection between them is almost non-existent, and many times, like when I was working in health information management back 6 years ago, okay, what I saw a lot of was they were still in that era where, if your primary care physician is supposed to send information to a specialist, literally the specialist's office will fax over a request to your primary care physician, and then the primary care physician, with their office, whenever they're good and ready, they're going to read that fax and they're going to go, well, looks like they need this one record. All right, well, let's sit on it. Let's put it aside, sit on it for a while, and eventually we'll get to it. We'll dig into that patient's record. We'll make copies of whatever they need, and then we'll fax it over. Okay, that is extremely inefficient, especially in many cases, since in many cases, a patient might be at or have an appointment that day with that specialist and they need your health information, but they can't get it. And eventually the primary care physician's office will fax over that information, but it might be a couple days, it could be a week or so. So you're not going to get it right away usually. Sometimes you do, sometimes there's efficiency. But in my experience, there isn't. Okay. All right, so EHRs seem like they're really great, right? They're gonna reduce a lot of medical error, they connect people, they make it really highly efficient, especially if you're part of the same network. So why is the progress of adopting an EHR system in your facility or facilities so slow? Even today, it's still not as efficient as it should be, as you would think, especially with adopting fully developed EHRs. See, most companies might do the bare minimum, okay? And that's not always the most efficient thing to do, as your facility is actually a little bit big, okay? So why is it so slow? Here are some reasons. The cost or the capital you have to come up with to adopt, to fully integrate an EHR system into your facility is huge. Okay, so these are very, very expensive. In addition, they're very time consuming. You can't just, it's not like you just go to the store, you buy new software, you install it in all your computers, and then everyone does a tutorial and you all know how to use it now. That's not how it works. Okay, so what you do have to do, typically what's going to happen is this is going to be a very long process. Okay, let's say you purchase one, and then it's probably going to be like a whole year of creating these project groups and having steering committees about how you're going to make the people, your staff, like fully understand, like just to fully understand how to use it. Okay, because this is medicine. You can't just go like, I think it's like this. You have to know. Okay, you're dealing with people's lives. You have to know exactly how to work this. You have to be a professional from day one when you launch it. Okay, so it's going to take a while to make sure that everyone is fully trained on how to use this, and it's just going to take a while to even get it completely integrated within your system. Okay, so it's very time consuming. It's not a one-time event either, because as you progress, like after you launch, you're going to notice kinks here and there. Okay, and when things like that happen, they have to be redid. It's like an ongoing modification that is going to be happening when you do that. So, and of course, after all that trouble, then it really just comes to mind, like, when are we really going to see this return on investment? Okay, when is the EHR actually going to pay for itself, like completely? Okay, and it's kind of uncertain because you just don't know how many medical errors you're actually preventing. You don't know how, like, what the value of that prevention actually was. Although that's a huge reason for why you're going to definitely be saving. That does count on, as your return on investment, but you don't know how much of that At a certain point, when can we say it paid for itself? Okay, so that's actually pretty uncertain. In addition to that, I mean, by the time it's technically paid for itself, can we really say that that's it? So we're going to use this forever? No, because the thing is, this is going to be years and years, and finally it's going to pay for itself. But by the time it's done paying for itself, it will probably be time for a major upgrade. You're probably going to have to invest in a whole new one. Okay, so this is what people are thinking. And this is why some facilities out there, especially smaller facilities, they're not really keen on the idea of opting especially a fully developed EHR system. Okay, moving on. Okay, so but in 2009, President Obama created this policy that really tried to get people to adopt EHRs. Okay, or at least EHRs that have some major components. Okay, so basically, what they did was they said all the people that accept Medicare, this is the deal. You are going to adopt an EHR system, and then we'll give you money. So they did this for all the physicians and all the hospitals and the major facilities out there. They said, you adopt one of these, and then we give you money. Okay, you're gonna get money. But if you don't, then we penalize you. So we're gonna take your money. They made them an offer that they couldn't refuse, basically. So of course people are gonna be like, all right, well, what are the minimum requirements in order for it to count for this whole package? Okay, the HITECH package, or the HITECH Act is what this was called. So basically, if your EHR system fits into the meaningful use characteristics, like they actually established meaningful use characteristics of an EHR system, and they said if you have these in your EHR system, then it counts and you're going to get the money. If you don't, then it doesn't count and we're going to take your money. Okay, so if anyone's actually really interested on figuring out what these meaningful use characteristics were, you can actually go online and figure them out. I put a link to a YouTube video that explains the HITECH Act a little bit, in more detail. And I believe that they give you the link for you to figure out what is actually included in meaningful use, so you can go ahead and check that out. Anyway, okay. You're all familiar with HIPAA. I know you are, because I ask you this every time, and you're just like, we know. Okay, so when all this EHR stuff came out, there have been some HIPAA concerns, some confidentiality concerns. So to sort of expand some of their rules and build on that, just to make sure that everyone felt that their information was safe. And you guys. Okay, so uses of internet and mobile devices. So, this is where we're gonna kind of get into seeing how we started to use the internet to benefit our health care, and how that really, basically, that really empowered us as patients, as people, citizens of this country and the world. The internet has really empowered us because it's given us so much information on our health. Okay, so there are three different types, or three different ways, I guess, in that we use the internet for our health care, and that has empowered us so much and solved many problems. So first we have eHealth. This is using the internet to access, let's say, your EHR. This is using the internet to even just Google symptoms, trying to figure out what is actually wrong with you. Or maybe your physician tells you such and such is wrong with you, these are the treatments, And then you go, I'm going to research these options myself and figure out what's best for me. Okay, so doing so, that gives the patients so much power in their health. They can actually become partners in their healthcare instead of just being afraid and doing whatever the physician says. Okay, so that gives patients so much more power. We're taking our power back thanks to the internet. Okay, next we have mHealth. So mHealth is it's basically eHealth, but you're able to use your wireless device. Okay, so you're able to use your cell phones or tablets to empower yourself with your health, to get your health information, to look at your EHRs and such. Okay, and then we have eTherapy. So this goes along with telemedicine, actually. Well, actually telehealth and telemedicine. And this is where you can have interactions with health professionals over the internet. Okay, so eTherapy through the internet. An example of this could be virtual physician visits, kind of like how we're doing this whole social distancing thing where everything is going virtual and we're doing what we're doing now. Like I am posting information as a video like this, and I know much of our courses and meetings and things like that are all happening on Zoom. So video conferencing is a huge thing now as well. So eTherapy, that's where you can get your health care through the internet. This can be through, through virtual visits like this, but it can also be just audio, it can be, emailing, instant messaging, things like that as well. So telehealth. Okay, so telehealth is pretty much spreading health information between, let's say, clinical professionals, physicians, researchers. Okay, so it's bringing everyone closer and allowing everyone to share information on health. Okay, it's just helping to empower us all, bring us all together, and helping us to understand more about our health. Then on the other hand, telemedicine is being able to get treatment from your healthcare practitioner, but at a distance, remotely. Okay, so, and there are two different types of telemedicine. First, we have synchronous, all right, and then we have asynchronous. So synchronous, this is when you are getting healthcare from your practitioner, but in real time. Okay, so real time, you could do video conferencing, you could do this maybe instant messaging your healthcare practitioner and telling him what's wrong with you, and then he'll say, hey, we're gonna run this test or whatever. I'm gonna give you this prescription. Also, telesurgery it's happening, and it's going to be further developed, I believe. Well, of course. So telesurgery would be you receiving surgery, like having surgery done on you, and it's gonna be like robots kind of working on you, while the physician is watching and controlling everything, but your physician is probably at home, okay, doing all this. All right. Asynchronous is when you're getting healthcare from your physician and it's not in real time. Okay, kind of like what we're doing here. All right, so this is not happening in real time. This is all pre-recorded, right? So your physician can actually pre-record things and then send them to you, and then, like, let's say you pre-record, what's wrong with you, your symptoms, your this, your that, or maybe you want to send photos of your rash or something like that to your physician. Your physician can look at it and be like, looks like this is what's wrong. I'm going to send them this medication or this prescription, and then that's it. So you're receiving care from your practitioner, but it was done remotely and it was not in real time. Okay, not in real time, totally separate. Another example of asynchronous telemedicine could be like, let's say you were told to go get imaging done. Like you were told to get x-rays done. Okay, so you go get x-rays at some imaging center, and then they send those photos to your physician, and your physician examines them. He's not doing that like while he's on the phone with you. Your physician might be doing that at home on the computer and figuring this out, and then he'll come up with his idea of what's going on, and maybe he'll send you a message or whatever. But that would be asynchronous. So then we have remote monitoring at home, and this is where you can get medical devices in your home that will monitor you. Okay, you can receive healthcare in your home. Okay, such as you can get like all this medical equipment hooked up, and then that way people who are at a monitoring center, usually other healthcare workers, they can actually check your vitals and everything going on with you remotely. Okay, so they can do all that remotely, and if something's wrong, then they will send help or take action. And so this is actually very useful, especially for those people who live in rural areas. So if you live in an area that's far away from a hospital or any kind of physician's office, and it's really difficult for you to get access to healthcare, this is going to help solve your problem. So what are some barriers to telemedicine? Because it seems like it's going to solve a lot of our problems, right? Especially right now, right? Well, some of the main barriers to telemedicine are the fact, or pretty much the main barrier, is the fact that we don't know how to reimburse it. We don't know the monetary value of telemedicine. It's really hard for us to figure that out. And usually when we decide on the monetary value of some sort of treatment, it's usually because Medicare has sort of set the tone for that, and then all the other private insurance companies and hospitals, they kind of look at that and they take Medicare's lead and they go, we should figure something out, sort of like how Medicare did it, but we'll just make ours way more expensive. That's basically kind of how it goes. Okay, they take Medicare's lead and then they just make it way more expensive and unreasonable or whatever. So until that really happens, and it's not going to be normalized. Okay, I know there are various different apps out there and things that people are trying to get going with telemedicine. Like you can receive healthcare services through an app on your phone and speak with a doctor, and maybe you'll have a membership, or maybe it's each video conference with the physician might be $40 an hour or something. There are apps out there that do that, and same thing with like counselors, especially in mental health, which I think is super important and very helpful that there are those resources out there. But it has yet to be normalized in our society, and it's because we just don't know how to determine the monetary value of this yet. Okay, so once we figure out the reimbursement structure of how we're going to handle telemedicine, we're going to find this becoming completely normalized in our society, and we're going to have less and less physical interactions with our healthcare professionals, and we're going to save that the physical interactions with them for when it's necessary, and then everything else we're just going to do remotely. And that's where I think the future is going with this. All right, so now we're going to look at how new medical technology diffuses itself into society. How does medicine become normalized? Okay, so there are a couple different levels. First, innovation. That is the part where research and development happens. That's when we come up with a whole new product. We get creative and we figure something out. We create a new product, technique, service, medication, whatever. Okay. Then diffusion is a step where we actually attempt to spread that particular technology into our society. Okay, so that is after this whole after it's like already been approved as like a medical device, it has, it's allowed to be sold and it's deemed safe and all of that. Then we diffuse it into society. At this point, we already figured out its monetary value. We, we can calculate, we can evaluate its benefit. Okay, so we have a good idea of what this is going to do and what it's worth. Okay, and then we start to diffuse it into society. So we start to normalize it, get all the different facilities to start using it and make it become part of our culture, like how we do medicine, right? Then the next step, utilization. So once it's finally in society and it becomes like normal practice for us all, then comes utilization. Utilization is really just sort of a rate. It's a way for us to measure how much it's being used. Okay, so we're going to see utilization actually come up quite a bit from here going forward. So like I think I've mentioned our technological imperative before. So in the United States, we have this technological imperative, which is this desire to have the best of the best technology that is available, and we want to use it. We want it to be part of our lives. We want it to diffuse in society. We want to have the best thing out there. We want to constantly be upgrading our lives and making things better, right? And we usually don't even care about what the cost is. We just want it. So it's this collective drive that we all have as Americans. And even though you may be like, I don't care about technology, I'm a minimalist or whatever. No, this is kind of like, it's like in our American DNA. It's in this country. It's the flow of how things work here. You may not feel like you are really part of that, but you definitely are. If you're here, if you've been here forever, that's just how it is. That's how we are. That's how we do it in America. So we have this desire to have the best of the best stuff out there, and despite the cost, and we always make a reason for it. It's going to benefit us, in such way. We're going to save lives, but really we just want cool new things. Well, So what are the major forces that drive innovation and diffusion? Okay, we're going to kind of go over that list of all the different things. So first we have our anthrocultural beliefs and values. We have actually been mentioning this a lot throughout this quarter, and we're probably going to mention this so many times more. So you should probably really understand this. Okay, our anthrocultural beliefs and values, especially as Americans, this is our collective beliefs and that we all share, probably to varying degrees, but this is something that's sort of like in the air. It's in the energy around us. In America, this is just how we feel. But so anyway, we have very high expectations of what technology can do. We have high expectations for modern medical science and how it can cure us. Don't you guys sometimes think about, well, if this happens, obviously they're gonna fix me, duh, why can't they? And then when something actually does happen to you, don't you get really, really mad that it's not fixed instantly? Don't you go, aren't you just really frustrated and you're mad, and you start hearing people say things like, they can put a man on the moon, but they can't fix my leg? So we get things like that, and we have that mentality here in America. Other countries don't necessarily feel that way. Okay, so they don't always feel as frustrated as we do when we don't get what we want with our medical technology, and they might not have those high expectations that we do. Okay? We have higher expectations than Canadians and Germans. Okay? So anyway. Next we have medical specialization. You remember how medical specialization shows up and one of the major reasons why we have encouraged new physicians to specialize in a particular field. There's a lot of support and a lot of kind of influence and push for physicians to specialize, and it's because we have so much medical technology, and we invest so much into that research and development and the medical technology. We encourage and we push people to go down that road in this country, right? It's part of our culture, it's part of our beliefs, it's part of how our system works. So the more medical technology we do come up with, the more specialists we raise, okay? And the more specialists we raise, the more they are going to want to come up with more medical technology, okay? It's this cycle. It's a cycle, all right? We got specialists, right? And they're coming up with new technology. And the technology encourages people to become specialists. And then when people become specialists, those specialists come up with new technology. I hope this gives you a good idea of how that kind of works. All right, so that's it. Next, we have the fact that health insurance, okay, we have, in this country, we don't have a single payer system, okay, where we have like a budget for our country and there's only so much we can spend on healthcare, so much we can spend on, medical devices and investing in technology and things like that. There's only so much money we have, or that they have, but we have plenty of money because everyone's kind of in it for themselves anyway. So we all have, as much capital as we have, and some corporations have a lot of capital. They got so much money out there. And so those people, well, that feeds into the system and of course creates more and more medical technology. Another huge reason why we have a lot of medical technology is because we have the expansion of health insurance, right? And the people in this country are always dumping more money into the system constantly on a daily basis because we pay our taxes and we pay our insurance premiums, right? So all that money is going straight over to these insurance pools, whether it's government or whether it's private insurance pools. We put money into them, okay? And those insurance pools are insulating patients and providers, okay? So the patient and providers, the providers don't necessarily have to compete with each other for the patient's business because patients have health insurance that tells them to go to those particular providers, okay? The providers know which insurance plans that these patients have, so they know what treatments they can do, they know what tests they can do, okay? And the patients, they don't know how much any of these medical treatments and these tests really cost. They're not out there shopping around, okay? They're not looking for the best price on anything. They have health insurance. Their health insurance covers it. So they're not worried. They don't think about like, wow, that's too much money, I'm gonna go to a cheaper doctor. No one thinks that way. Okay, so when a patient feels like they need some sort of health service, they got insurance, they're going straight to the doctor. And the doctor goes, you know what? I'm gonna try to get as much money as I can out of this patient because that's gonna pay for my new yacht. So that's what they do. And the thing is, they're completely insulated. Okay, so no one's really looking at the situation like, ooh, there's too much waste or too much money is being spent in this situation. No one's trying to be conservative at all here. And what it results in is so much unnecessary waste and exploitation. okay? And this waste and exploitation is moral hazard, okay? This is the term that refers to what happens when we insulate the providers and the patients through health insurance, okay? Provider-induced demand is another result of insulating the patients and the providers through health insurance, okay? And what this is, provider-induced demand, is the doctor can demand or creates the demand for services, okay? And how do they create the demand for services? Because we don't know what we need. We don't have that kind of knowledge, okay? Well, yes, we have the internet now, okay? We are becoming more empowered, but for the most part, we still don't know everything, and we still feel like we need to rely on physicians. Okay, we still do have that trust and that reliance on medical technology and our physicians. So we really don't know what's actually wrong with us, and we don't know what we need. We don't know if anything's wrong with it. Maybe it's nothing, okay? But we go to a doctor and they'll be like, well, you need such and such. This is wrong with you. That's wrong with you. I have to do this and this and this, and we got to take all these tests, and then we'll just make sure that it's not this. And I'm also going to give you these different pills. And in that way, the provider they create their demand for their services and make their money. Okay, so next we have another force that drives more innovation and technology is the competition among providers. Okay, there's competition among hospital competition. There's facility to facility, like private practice to private practice competition. And there's also competitions with insurance companies against each other. And that's all going, so the investment in all this new medical technology kind of sets the tone or whatnot, or like helps drive that desire to get more medical technology so that patients will come see me. All right, so patients are more likely to come to my place, to my practice, because let's say I have this amazing facility. We use all the latest advances in medical technology. We have a fully integrated EHR. We're just so efficient. We're like boom, 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 boom. You're out of here, you're in. You don't have to wait so much. We're clean. We're fun looking. You just enjoy the environment when you're at our facility versus the crappy one down the street where they don't really invest too much in their medical technology and they're just, okay. Versus, so that can definitely drive medical innovation, diffusion, and just the need to get that new medical technology into your facility. Okay. All right, let's move. Okay, so expenditures on research and development. Of course, that's going to drive innovation and diffusion because that's the money that's invested in researchers so that they can come up with these new innovations. Okay, and the whole point of, coming up with all this new medical technology is to diffuse it into society so we can all make money. That's the whole point. Okay, well, the government, in addition to private organizations, because obviously private organizations are definitely going to invest in innovation and diffusion, especially with healthcare. There's a lot of money there. But the government also invests a ton of money into research and development as well. So the government's also part of this, and they also like to see innovation and diffusion come out. Force. Next, we do not have any kind of supply side controls. So we don't have this, right? And that's So that allows the force of innovation and diffusion. Whereas with other countries who do have supply side controls, they have those barriers that stop them from innovating so much. Okay. So anyway, government policy. This is also another thing. Okay, so the government really doesn't do too much to hinder the growth of innovation or diffusion, especially with medicine. Well, they also, they invest in it, they want more. So of course they're not going to hinder it too much. But what they usually do is at least they try to make sure that these medical products that are going onto the market are safe. And they're going to have different classes of ways that they regulate these new medical devices and medical technologies. Okay, so a huge player in this game is the FDA, right? The FDA, we all know who the FDA is, right? So they like to regulate safety and effectiveness, and of course access to these drugs as well. So they're going to determine whether this is like a type of drug that requires some sort of prescription, or if it's going to be something that you can just get over the counter. So there are different classes that the FDA likes to put the different medical devices in. Okay, these are the different medical device amendments. So this whole system started in 1976. All right, class 1 is probably like the easiest, the least stringent, and then class 3 is going to be the most strictest class. Okay. So anyways, we're not going to get too much in this because we're definitely not going to be testing on all of this, but I do want you guys to be familiar with the fact that there are different classes, okay, that we place these drugs in. Okay, class 3 is going to be the most strict, class 1 is least strict, class 3 requires market approval, government approval, all that. The type of things that fit into the class 3 will be things like tissue, like medical tissue, organs, things like that, like blood transplant or blood transfusions, stuff like that. So those, of course, would be like the most strict, obviously, because this is biological medical technology, right? These are biologics. Let me put biologic there too so you understand what that term is. These would be considered biologics. Okay. So the Safe Medical Devices Act of 1990 was put out there to make sure this was just for patient safety and whatnot, right? So it made it a requirement for healthcare facilities to report any kind of serious or potentially serious related devices, right, that are related to injury, illness, or death, right? And they have to report all this to the manufacturer so that the manufacturer can deal with it, okay, so that they can improve their device or whatever they got to do, but the manufacturer has to deal with that. And especially if there's death involved, the FDA has to get involved as well. We through some of these, but I do want to invite you to actually just look through these slides and kind of get familiar with. Okay, and of course you guys all have the copy of the original PowerPoint, so you can use those on your own discretion, and you don't have to necessarily have my face here talking to you all day. Okay, so a lot of these are going to get into like what's going on right now and what's happening with the future and how do we determine the efficiency of these technologies. So those were what those slides are all about. I do want to point out right here, because you will see this, HIV/AIDS has become, well, thanks to a lot of our medical technology, especially these antiretroviral therapies that we have, we've managed to make HIV/AIDS no longer a death sentence, okay? It's no longer a death sentence if you get it. It's just a chronic illness. And everyone, we got chronic illnesses all over the place. It's so common. So it's not too much of a big deal anymore. I think most of the problem with HIV and AIDS is the fact that it is associated with so much stigma, but as a disease itself, it has become a chronic disease, which is very manageable, okay? Although the management of this disease can get quite pricey, but it is manageable and it is covered by Medicaid, so. All right, let's moving and I hope you enjoyed lesson 5, chapter 5 with medical technology. I'll see you in lesson 6.